What is mental health? How do you define it? The mental health definition is different for everyone based on their own understanding, right? There is no definition of mental health which is standard, right? So that's the beauty of mental health. What's your definition of mental health may not be your definition of mental health, may not be your definition, may not be your definition. But the bookish definition is mental health includes our emotional, psychological, and social well-being, and that's kind of what you guys said. It also says it affects how we think, feel, and act. You kind of said that too. It helps us determine and handle stress. You guys mentioned that too. It is important in every stage of our life, from childhood to adolescent through adulthood. So it kind of encompasses everything you guys said. But the main message is mental health has no one definition, and the definition can change from person to person, point to point, age to age, and situation to situation. That's one thing. Then comes, what are the types of mental illnesses? So psychiatrists define mental disorders into different groups. The first group is anxiety disorder. And in anxiety disorder, we include PTSD. In anxiety disorder, we include obsessive compulsive disorder. In anxiety disorder, we include OCD, all those in anxiety disorder, because they have an element of anxiety. That's one group of disorders. You mentioned disorders. Second group is mood disorders, which includes bipolar and depression. What's the difference between bipolar and depression? Anybody knows? And to have a diagnosis of bipolar, you need to have just one high in your life. So even one high in your life at the age of 18 will make you have a diagnosis of bipolar the rest of your life. Which people object that I've never had any highs except for one. I've always been depressed. Why call the diagnosis of bipolar? But that's enough for the diagnosis. The third is schizophrenia or psychotic disorders, which is a thinking problem, a thought disorder. What does it mean by thought disorder? These are people who have delusions. How do you define delusion? But delusion's definition is fixed false belief. When somebody has a fixed false belief. I work in the ER. I've seen Jesus, I've seen Trump, I've seen everybody. People come and say, I'm Jesus. That's a fixed false belief. People come and say, I have 20 million in my account. What are you doing in Bentop then? I mean, if you have 20 million in your account and they don't have any shoes or anything. But I mean, people have, those are delusions, right? Fixed false belief. Delusion, that's delusion. Then hallucinations, hearing voices of people not around you, seeing visions. Those are all thought disorders, either schizophrenia or psychosis. Paranoia, feeling people are following you, people are after you. Those are all in schizophrenia or psychosis. Then personality disorders, complexes, borderline personality, manipulation. Those are all in different kind of personality disorders. But there are many personality disorders. Borderline is one, but there are many personality disorders. Dependent personality disorder, OCD, avoidant personality, paranoid personality, multiple personality disorders. Then cognitive disorders, dementia, intellectual disability disorder, IDD, or mental retardation. Those are cognitive problems. Those are also affected. And then eating disorder, as somebody mentioned. So the difference is anxiety disorder is one spectrum, mood disorder is another spectrum, schizophrenia is another spectrum, personality disorder cannot be modified with medications. Cognitive disorder cannot be modified with medication, and eating disorder is a separate spectrum. Out of these, which one is the most common psychiatric illness? It is anxiety, which is the most common, followed by depression. Okay? Okay. Now, when do these illnesses start? 1/3 of all mental illnesses start before the age 14. That's the reason we, as a psychiatrist, emphasize in picking up signs and symptoms in school, in young kids. Why? Because if they're going to start in young kids, we need to pick up these illnesses in school age or in young age. Because if you're going to miss them, you're going to miss them in school age. And then they will be full blown, and then any By definition, any illness, if you don't treat, is going to get worse, right? So if you treat them early, you can treat them better. But if you don't treat them early, it's going to get worse and worse and worse. So you treat them early. Substance abuse also start early, and we'll talk about substance abuse also. Okay? What's in between 50 and 90? 75. 70 is the answer. Okay. And unfortunately, we live in Texas. Texas is the last for the access of children's mental health services. Depression. If somebody has depression, how long do you treat depression? Second question. What is the most common risk factor for suicide? What percent of patients with depression have anxiety? Okay, let's just talk about depression. So depression is very significant, of course. While anxiety is very common, it may be milder than depression. Depression is very significant. Does anybody know what percent of depressed people commit suicide? About 10 to 20% of mood disorder people commit suicide. About 10% of schizophrenic people commit suicide. About 10% of personality disorder people commit suicide. So 10-10, and mood disorder is 10 to 20%. Depression is one of those things which is always underdiagnosed, undiagnosed, misdiagnosed, undertreated. Why? Because people think of it as anxiety or bipolar or so, give people Ativan, Xanax, those kind of things, and wrongfully diagnose it. Women are depressed more than men. Do you know why? Yes, somebody said something. Yes, please. No, go ahead. Yes, you are absolutely right. Women are. One second. So she said women get depressed more because they live with men. Okay, 1 second. So she's right, but men get psychotic more because they live with women. See? Okay. But the correct answer is women get depressed more because of hormones, because of estrogen, and because, to be fair, they have a more sensitive personality and they are more caring. So these are the symptoms of depression. Out of these symptoms, which symptom is the most significant, or one symptom which is the most important to make the diagnosis of depression? Lack of interest is one symptom which is the most important to make the diagnosis of depression. And let me explain why. Have you ever seen a depressed person with lots of interest, enjoying life? I mean, if you're depressed, you're not going to enjoy life because you're depressed, right? So actually, if a person comes to me or comes to us and is showing interest in life, they're not depressed. They're just telling you they're depressed, because depression will take away interest from life. Sleep in depression can be up or down, more. Some people sleep too much, some don't sleep. Guilt, yes, they're guilty, but they can be guilty in other things also. Why they're guilty? Because somebody is telling them, this is all your fault. This happened because of you. People make them guilty. Energy is decreased in depression, but energy is decreased in anxiety also. Concentration is decreased in depression, but that's decreased in anxiety and in ADHD also. Appetite can be increased in depression, but some people eat too much in depression too. Psychomotor retardation, yes, is there in depression, but sometimes it can be agitation also. Suicidal thoughts are there in depression, but not every single person with depression, not 75% of the people in depression are committing suicide. So it is the interest, which is I like to associate diseases with one symptom. If you remember one symptom, you can make the diagnosis. You all can become psychiatrists with one symptom. Interest. Interest is the key for depression. The diagnosis of depression is you have to be clinically depressed for 2 weeks. The symptoms which we mentioned need to happen for 2 weeks or less if you are suicidal and hospitalized. Dysthymia is a low-grade depression, same symptom but low-grade, but lasting up to 2 years. It used to be called dysthymia, and now we call it persistent depressive disorder. Bipolar 1 and 2, what is the difference between bipolar 1 and 2? In 1 you have mania, in 2 you have hypomania. What's the difference between mania and hypomania? Hypomania is a lesser degree of mania, meaning if the volume of manic symptoms is 10, which is high, in hypomania it will be 5, kind of less. Adjustment disorder. What is adjustment disorder? That is situational depression. meaning we see a lot, especially in the emergency room. Broke up with a boyfriend, depressed. Got a new boyfriend, better, more happy than before. Situational depression, right? That's not clinical depression, but it happens, right? So that's situational depression called adjustment disorder. Or slashed your wrist because broke up with a boyfriend and then happy again, finally. Or, divorces. But some divorces end up in happiness also. It just depends. It just depends. It just depends in which relationship you are, right? But that's situational depression. First episode of depression, we usually treat up to 9 months. You have been depressed one time in your life, and we're talking about 2 weeks of depression. You treat 9 months. You have been depressed 2 times in your life, twice. We treated 2 years. Why? Because the chance of recurrence is up to 70%, meaning it can happen again. So you treat it for 2 years. If somebody has been depressed 3 times in their life, then we treat it forever. So for simplicity, remember 1 episode of depression, 1 year, 2 episode, 2 year, 3, forever. What are the treatment options for depression? Of course, the first is psychotherapy.